Hello there, Dr. Andrea Shanowski from Freedom Chiropractic and Holistic Health, and I want to welcome you to Wellness Wednesday on Health and Horsepower, our YouTube channel. So today I'm going to talk a little bit more about bone health because there's no bones about it. You can take care of your bones yourself. It's really important to understand that there are 3 things typically that you had no idea happens with your bones and how they function and heal and remodel, and also 3 things you should be doing on a daily basis. So we've got a 3x3 today. We're going to talk a little bit more about joints. So your joints and bones, when they are injured, when they have damage to them, as your body repairs, it actually builds them bigger. So if we had a fracture, that bone will be enlarged after it's healed. If you've had damage and wear and tear on a joint, your body will build arthritis that will also enlarge that bone. So bones become larger as they heal, which means we have less and less space, especially if we have a lot of repetitive traumas and injuries. So it's really important to understand that if we can prevent the injury in the first place, you're going to be much better off and have plenty of room for your nerves and your ligaments and your muscles to do what they need to do. Number 2 thing that you may never have heard before is that when it comes to osteopenia or osteoporosis, we want to talk about bone density. So your bone is made up of basically a matrix on the outside of your bone that's mostly made of calcium. The inside of your bone is made with calcium, magnesium, and phosphorus. So we want to make sure as much as possible we are getting enough of those nutrients, because when you have osteopenia, typically the inside of your bone, which is the actual density inside, not the framework on the outside, but the inside, if your body is not getting the right nutrition, it will actually steal the calcium, magnesium, phosphorus to take it elsewhere in the body where it's used. And then you'll get thinning, or the density will decrease on the inside of your bone. That's what's called osteopenia. Now, if it gets to a certain point, it may be called osteoporosis. And that's when basically the bones are so thin inside that they can collapse in on themselves. And we can see fractures where the bones basically just cannot support the weight of your body and compress and crush, kind of like a aluminum can. So it's really important to understand that we can have osteoarthritis, which is when your body builds more bone, or osteopenia, which is when the bones are very weak. Now, a lot of times our doctor may recommend a medication for us to help prevent bone loss. The problem is a lot of those medications have very serious long-term side effects. When we go on a bone medication to basically prevent osteopenia and osteoporosis, that stops your body from breaking down bone, and that also stops your body from breaking it down and rebuilding it stronger. So a lot of times we will see, especially with long-term use over 3 years, that we will see an increased risk of abnormal fractures that are much more difficult to heal from, much more difficult to have surgery on, and a lot worse outcome. So very important, as much as possible, you want to protect your bones, keep them strong, so we can prevent osteopenia, osteoporosis, and especially any fractures or the need for medication if our bone density is pretty much gone. And the number 3 thing that is really important is something called Wolff's Law. So you may or may not have heard of this before. Wolff's Law is the fact that your bones remodel. So they remodel based on biomechanic load. So when you put pressure on a bone, your body will say, hey, this guy needs more support. Your body will actually increase the bone density of that bone to support the weight. So if we can actually change how you're putting pressure on your joints and making sure you're having the right nutrition, your body can rebuild bone and literally reverse osteopenia and osteoarthritis. And we're going to talk about how to do that with our next 3 things. So the 3 things that we need to do to basically start protecting our bone health is, number 1, making sure we're getting the right nutrition. So those 3 minerals that I mentioned, calcium, magnesium, phosphorus. Calcium you can find typically in a lot of different foods. A lot of times we have calcium fortified foods as well, but your biggest sources are going to be things like dairy, squash, seafoods, and also almonds are another good source of that. For the magnesium, now magnesium, typically we'll find that a lot in dark green leafy vegetables. So spinach is a really good source. You can also find it in pumpkin seeds. You can also find it in beans and legumes as well. Magnesium can also be taken in a pill form. You can also get some absorption through Epsom salt soak. So that's another way to get it. I've also seen some magnesium lotions and even magnesium sprays that you can apply on the skin and actually rub in to help absorb or at least get magnesium on an area too. The other great thing about magnesium, it's a natural muscle relaxant and a natural relaxer. So it actually helps to relax muscles and prevent muscle spasms and cramping. It helps with sleep. It helps relax your smooth muscles. So it helps with blood pressure, digestion. That's a really good one to make sure you're adding in. And then the last one is phosphorus. So phosphorus is a mineral. Typically, we're going to find it in some dairy products, but we are not going to find very good sources from plant-based sources. So typically dairy, meats, seafoods, also some legumes and nuts will have that in there. So really important to make sure you're getting those 3 minerals. The other thing that's really important, because we talked about Wolff's Law, is that we also want to make sure we're getting enough protein. Typically, you want to aim for about half your body weight in grams. So if you're 100 pounds, 50 grams of protein daily. That may be much more than you're used to getting. And if you are a bit older, typically our stomach acid decreases as we age. So we may need to add some betaine HCl or some of the Gastro Plus that we carry in our office to help break that down properly. And protein helps to build your muscles and your enzymes so your body can actually make the muscle stronger. So it pulls on the bone and stabilizes the bone so it can get stronger. So that's another really important thing when it comes to nutrition, is making sure you're getting calcium, magnesium, phosphorus, and protein so that your body can remodel and make sure that those muscles and ligaments stay strong. The number 2 thing that we need to make sure we're doing is we are loading our joints and putting pressure on them so that they can remodel stronger, just like we talked about with Wolff's Law. So one thing that you can do is definitely making sure that you are walking and putting pressure on your joints. The better posture you have when you are walking and doing exercise, the pressure will actually go all the way through your spine, so it'll strengthen everything. Normally, I recommend doing posture strengthening exercises, body exercises where you're using your body weight. If we don't have osteoporosis, I would also recommend doing some weightlifting exercises where you're using weights. Typically, when you use weights, you're loading your joints and also putting pressure on the muscles so they can remodel. So that's a really, really, really good thing, is to do some weightlifting. To do that safely, you may need to work with a athletic trainer or even talk to, I know there's some Silver Sneakers classes in the area that are really great too, to making sure that we're able to load those bones safely. And the number 3 thing is making sure we keep our joints moving. When your joints stop moving, they start wearing and tearing and breaking down faster. So very important that you keep your joints moving. Any restriction will typically cause arthritis to form. So chiropractic can be really helpful to keep your bones moving. I also mentioned posture exercises, but chiropractic can also help improve your posture so you can do more of those exercises and build those muscles back faster. So really important to make sure that as much as possible you are keeping your joints moving. That's number 3. So to review the 3 things you didn't know, we talked about how your bones enlarge when they're injured. So very important to make sure we don't injure our bones so we don't have less space for our nerves. Number 2, we talked about osteoporosis and osteopenia. Number 3, we talked about Wolff's Law. And then we also talked about 3 things you should be doing. So number 1, get the right nutrition. Number 2, load those bones with exercise and also weightlifting if you can. And number 3, keep your joints moving to protect them and keep them safe. Have a great rest of your day. Thanks for joining us for Wellness Wednesday. Make sure to tune in next week. We have some spooky recipes that I'll be doing with some of our special guests as they help me out with those.